Good afternoon to our televiewers. This afternoon, I'm very fortunate to have a colleague with me. She is in the practice of psychiatry and also in the field of physical therapy. Her name is Dr. Geraldine Sayo. Good afternoon, ma'am.
Good afternoon, doctor.
Yeah, I would like to welcome you in our office here at Quezon City because of the partnership that we have established over the last couple of years. And because also of the plan that pretty soon we will launch another project through the Center for Holistic, Alternative and Restorative Medicine, the so-called Healthcare Professionals Doing Housecalls. How do you feel about this idea, Doctora, about the healthcare professionals going to the homes, the offices of patients? How do you find this approach?
This, I think, is simply back to the basics, doctor.
Yeah.
When we were young, the doctors used to come to our
Right,
house.
right.
And I think that's I'm now a doctor myself. It's about time that I also give back to the patients who need my service, but who cannot leave their house, including the elderly. Okay, so I'm also a geriatrician. I am involved in the wellness of the elderly. And even though I'm a psychiatrist, I practice the holistic approach, meaning I take care of the body and the mind, and also the spiritual side of a human being. Because a lot of illnesses nowadays are brought about by poor interactions between these three aspects of ourself.
Right.
Okay, so
And do you think because some doctors or healthcare professionals think that majority of patients would still like to avail of a medical center setting or doctor setting in their healthcare? Do you think, is there a basis for saying that the psychology is still towards going to the hospital or to the doctor's clinic?
because of the influence of the modern technology, the Western medicine, it is an acceptable concept. Of course, we have to go to the doctor and subject ourselves to the laboratory diagnostic tests in the facilities. However, not all patients can do that. It can be a plus factor if you can give the comfort to the patient if he doesn't feel well. Also help him lessen his expenses. If you can provide the medical treatment, the psychological help that he needs in the comfort of his home, then